Top healthcare officials are also expressing concern about the virus overwhelming our bed capacity. This comes on top of an earlier warning from Dr. Angela Dunn, our state's epidemiologist, who sent out a similar concern. News specialist Dan Rascone continues our team coverage. Dan, at least right now, there seems to be plenty of beds.
Yes, that is true, but here's the issue right now. That spike in coronavirus cases usually doesn't translate into hospitalizations until 2 to 3 weeks down the road. So the concern right now, if this trend continues, then that's when our hospitals can become overwhelmed. If you come to St. Mark's Hospital with COVID-19, you're bound to meet this man, Dr. Jared Johnston, the critical care unit medical director, who is definitely concerned.
Is it a worry?
About the major spike in coronavirus cases across the state.
3 weeks ago, I had no COVID patients in my ICU.
Today, there are 9 patients with the virus at St. Mark's, 2 of them in ICU. But Dr. Johnston believes they've never been better prepared to handle an increase. They have 18 beds in the ICU, but in an emergency situation, they can go from 18 to 60 beds if needed.
In this hospital alone, we have the ability to more than triple the number of ICU beds in the building.
According to the latest numbers, 34 new hospitalizations happened today, bringing the total to 166 people hospitalized with COVID. 62.1% of the ICU beds across the state are occupied, and 44.9% of non-ICU beds are taken. Intermountain Healthcare says they are concerned about the jump in numbers.
If we continue this trend and we do not abate the crisis that is going on now, we will reach capacity in the coming weeks, and we will no longer be able to care appropriately for patients with COVID-19 and also those that seek care for other reasons.
As a result, they have a contingency plan saying it will move young patients from Riverton Hospital, McCady Hospital, and Utah Valley Hospital to Primary Children's. Then the pediatric units there can treat COVID patients. Primary Children's is also ready to accept virus patients up to age 30. But for now, it's a wait-and-see game.
Those positive cases are the leading edge of what then follows several weeks later.
But even with the spike here, doctors still remind folks, if you have a medical condition and you need to get to the hospital, don't hesitate. Still come to the hospitals. Don't feel like you're going to get the virus or you're going to somehow overwhelm the system. Deanie, back to you.
All right, Dan, thank you.